Good afternoon, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar. Let's welcome today's speaker with great honor, none other than Professor Dr. Sunil Kumar Agarwala, sir. And let me share some of the achievement of sir. Sir has done MBBS, MD, Professor at the Department of Pediatrics at Sardar Vallabhbhai Patel Postgraduate Institute of Pediatrics, Cuttack. And today, sir is going to discuss on a topic update on immunization for all ages. By taking not much time, I would like to invite sir to know about more this topic. Over to you, sir. Kindly proceed from here.
Thank you very much, Faraj, from IJCP for your nice introduction. Good afternoon, all dear doctors. I thank all of you for taking time out of your busy schedule for this webinar. Always we know we doctors are always busy and we are at the cost of our health, our family health towards the patient health. Having said that, always we say that we learn from our MBBS and PG knowledge that prevention is better than cure. I will say, suppose a child is dying of pneumococcal meningitis. So you must be thinking, was there any way that this meningitis would have been prevented? Answer is yes, it was due to vaccination. From the era of Edward Jenner, from the era of Louis Pasteur, they have brought the antigen inoculation into the body, bringing the limelight of the T and B cell system and stimulating the immune system and providing adequate immunity for a longer period, and that is going to save a lot of diseases in children and as well as in adults as well as in older population. The best answer to this immunization vaccination in the global scenario, we learned a lot of lessons from COVID pandemic. India shown to the rest of the world how India, the indigenous vaccines, Covishield and Covaxin, can do wonder in the global scenario. And we have given 220 doses of crore doses of this COVID vaccine. Having said that, always we remember vaccines do not save lives. Keeping vaccines in the ILR or the fridge or the domestic fridge is not going to save life. It is vaccinations that do. So dear doctors, let's go ahead. What are the recent most immunization guidelines followed in India? We are in India. We have to follow some guidelines. And these guidelines, if I say one after another, the most important guideline which is being followed in India is National Immunization Program, which has been started way back to 1985 onwards in the name of UIP program. The beneficiary are under 1 kids, then it has expanded to under 5 kids, then children up to the age of 16 years and pregnant ladies. So this vaccine, which has been updated in the last year, 2023, in 2024, in May today, in 23rd, also we are following this vaccine program. Or this is known as National Immunization Program or National Immunization Schedule. This is synonymous with our Government of India schedule for India. We know there are a couple of vaccines, they are being given at different points. Once after delivery, the baby is okay, vitally stable. We are going for BCG in the left side at the insertion of the deltoid and intradermally. The dose is 0.05 ml till the age of 1 month and thereafter 0.1 ml. Oral polio vaccine and hepatitis B. The most important part here, please remember hepatitis B to be given as early as possible within 24 hours of birth. Why? Because now India is intermediate endemic country for hepatitis B is concerned. In order to prevent hepatitis B transmission from mother to baby, it has to be given hepatitis B vaccine as soon as possible, preferably within 24 hours, so that 75% the transmission of hepatitis B antigen from the mother to the baby will be curtailed. Coming back to 6, 10, 14 weeks, we started hepatitis B rolling in our country from the age of 2002 onwards. And now it became a part of pentavalent antigen, and this contain DPT wholesale. Then there occurs HIV, that is Haemophilus influenzae B, and as well as hepatitis B. This is given in 3-dose scenario, 1 month apart, 6, 10, 14. Then comes oral polio vaccine, which is given as a 2-drop schedule, and it is bivalent oral polio. India became polio free since the age of 2014, but still then Pakistan, Afghanistan, 2 countries are now endemic So both are neighboring countries to India. So that's why we are giving oral polio as well as IPV, that is inactivated polio vaccine, in our schedule. Coming to inactivated polio vaccine, that is ID schedule, which is a mitigation strategy that is given at 6 weeks, 14 weeks, and another at 9 months. So this is 3 dose schedule because our children are naive to polio virus 2. So to have robust immunity against virus 2, we have to go with the trivalent IPV, that is inactivated polio vaccine. Salk antigen is being given, and it is given in zero point 0.1 ml. And this vaccine is given in the upper arm intradermal region, and 3 doses. Previously it was 2 doses, but last year onwards it became 3. That is to confer antibody against all the 3 pathogen. This 3 dose schedule has been adopted by Government of India. Coming to pneumococcal, you must have seen last few days back the pneumococcal vaccine was there in our country, that was PCV 13. Now PCV new 10, that is pneumococcal, has been rolled over, and PCV 14, which is the 14 valent pneumococcal conjugate vaccine marketed from Dr. Reddy's Limited, Hyderabad, has been incorporated into the NIP since last few days in this month only. And it is given in a 2+1 schedule. One is given 6 weeks, another at 14 weeks, one booster at the age of 9 months. So these couple of vaccines which are given here, the beauty is that in 6 10 14 we are giving oral polio as well as IPV at 2 points. One is 6 weeks, another at 14 weeks. Coming to 9 month, it is now the 9 month vaccines are being crowded. MR vaccine, the measles has been converted to MR since the age of 2018-19 onwards. JE vaccine in JE declared endemic district in the India. There are 350 plus endemic district declared by the Government of Health, that is given. And now some places it is the live attenuated vaccine is given. Some places the JE vaccine, that is from the collagen, is from the biological E, that is being given in the name of JIP, and that is given in some states. Now PCV booster, either it is PCV new 10 or it is being PCV 13, doesn't matter. One booster is given at 9 months and another IPV is given at 9 months. Coming to the booster, we know whatever antigenicity and the immunogenicity is developed over the years, it is going to decline. And in order to maintain the good anamnestic response, we have to give one booster in the age of 16 to 24 months. That is popularly known as 1.5 year first booster. In case of DPT, booster 1. And MR is given in 2 doses, that is MR2, and JE is given in 2 doses, that is JE2, and along with OPV, oral polio vaccine. Coming to the second booster of DPT, which is given at 5 to 6 years, which is second booster, and there no OPV, no IPV is recommended. Coming back to 10 year, that is the third booster, we know the complete antigen DP is not recommended beyond 7 years because of highest amount of local reactogenicity. That is the reason TD, that is the complete T, and the small amount of diphtheria antigen is given at 10 years and another at 16 years. And this TD is been replaced from TT vaccine. Now WHO told all over the world the TT has been converted to TD. So no more TT is mono dose vaccine is available globally. Pregnant mother, each pregnancy we have to go 2 doses of T containing vaccine in the name of TD1, I mean TD2, that is in between pregnancy, I mean throughout the pregnancy, at least 1 month apart. And if the pregnancy occurred 3 years within, then 1 dose of TD will be enough. So this is the latest immunization guideline for India, and we have to follow this. Because in India, if you are vaccinating, if you are a vaccinator and doing office practice, you must remember that 2 things. You have to follow either this Government of India guideline or the another guideline which is known as IAP, that is Indian Academy of Pediatrics, or otherwise known as ACVIP guideline, Advisory Committee on Immunization and Practices, that is ACVIP guideline. That also recommended in last year 2023. It has not been the same thing is being continued this year as well, and we have to follow that. So this vaccine schedule, we have to update ourselves from day to day because these vaccines are upcoming schedule. There are new entrants are there. When vaccine schedule in government started in the year of 1985, at that point of time, 6 antigen was there. Now we are catering to 12 antigen. So the last antigen which has been introduced into the NIP was PCV, and 2023 January onwards, all over the state, there are 28 states and 8 union territories we are giving PCV vaccine as a part of national immunization schedule. So coming to one antigen, preferably single IPV in NIP. Already I told it is given in upper arm and preferably on the right side, and this given as 0.1 ml. If you are giving intramuscular dose, the dose is 0.5 ml. Now the solo isolated intramuscular IPV, that is 0.5 ml, is no more available or rarely available. But usually in office practice, it is given as a part of a combo vaccine. But in national immunization schedule in government sector, it is given at 3 dose, 6, 14, and 9 months. All are ID doses. In office practice, there is no placement of ID IPV. If you are doing IPV, then only it will be a part of a combo vaccine. So 6, 10, 14 weeks, you are giving IPV as a combo vaccine, which will be discussed later. So in this one after another, if I am saying, coming back to the second schedule, already I discussed about the national immunization schedule. So let's have a focus on light on IAP schedule 2023. Once we are giving vaccine, we must be well updated about the recent guideline or immunization guideline in our country which is being followed. Either it is Government of India guideline or IAP guideline. Coming back to birth dose, it is same as BCG, OPV, and hepatitis B, and it is told that hepatitis B given to all kids, those are vitally stable. Now, previously there was a caveat that 2 kilo above it is to be given, or else 1 month chronological age, that has gone. Now the new guideline says that each baby, if it is vitally stable, they will be given. Why? However, 3 doses of hepatitis B are giving at 6, 10, 14 weeks as a part of a combo vaccine. So in a lifetime, one has to get 3 plus 1, 2 plus 1, that is 016, or at birth, and 3 doses in 16, 14 weeks has to be given, and there is no recommendation of the booster doses as of now. Coming to 6, 10, 14, just like pentavalent vaccine, in office practice, we are giving hexavalent. Why? That pentavalent antigen plus, and there is a IPV antigen into that, and either it could be W or it could be acellular, doesn't matter, the hexavalent 1, 2, 3. Rota vaccine 1, 2, 3, this is given in 5 drops, it is given into 6, 10, 14 weeks. PCB 1, 2, 3, that means 3 plus 1 schedule recommended in office practice. But if you go back to the whenever we are going back to Government of India schedule, you see that Government of India schedule, the PCV is given in doses of 2 plus 1 schedule, whereas in Government of India they are giving the base schedule for the individual. The basic difference, you must know that the Government of India is for community. So whatever you are going, the less cost and the best benefit to the community. That's why the Government of India schedule is being there. 91% of vaccination in the country is being taken up by the government sector. Only 9% of vaccination are being taken care either by the pediatrician or the PSM or by the TB and chest or by the gynecologist, or you can say by the medicine people. And that is attributing towards 9% out of the 100% immunization being taken or given to our children and adults in our country. So coming back to again beyond rota, there are 3 doses has to be given. Here, no rota has to be initiated after 14 weeks, 6 days, and no rota to be given beyond 8 months. That is a narrow schedule in fear of interception. Though interception is not more than the background rate, still then it has to be given in 3 doses. So there is another vaccine which is given at completion of 6 months, that is flu doses to be given 1 and 2, 1 month apart, and 1 dose, single dose of typhoid conjugate vaccine is recommended at 6 months. 7 months, again, if you have given flu second dose, then in the next year onwards, the peculiarity is that almost pan India, except Jammu Kashmir and Kerala or Tamil Nadu, they are being given in pre-monsoon, that is in the month of May and April. It is given whatever the latest strain is available, either it is northern or southern, doesn't matter, and it has to be given in single dose, annual dose till the age of 5 years. Then come to 9 months, that is MMR1, and that is MR in case of government schedule. But IAP says the best protection, because you must be observing now upsurge of mumps cases pan India. And that is the time has come that you should give mumps protection to your kids, because Even if the percentage wise is low, but still then we are getting mumps, aseptic meningitis, mumps related, followed by that autoimmune encephalitis cases we used to see. So the best protection, the morbidity has to be declined by giving mumps containing vaccine, that is MMR1, and MMR2 is given at 15 months, and there is another MMR which is given at 4 to 6 years before school entry. You remember the rubella, one dose is enough. For measles, two doses are enough. For mumps, the immunity is not that robust, but still then three doses are optimal. Then coming to 12 months, after completion of 12 months, the anti-hepatitis A antibody goes down, and that is the time when we can give inactivated vaccine in two dose interval, one at 12 months, another at 18 months. If it is a live hepatitis A, we have to go for single dose vaccine subcutaneous. 15-month second dose of MMR I have already told, and now the varicella is taken up in a narrow schedule, varicella 1 at 15 months and varicella 2 after 3 months, that is at 18 months, in order to reduce the breakthrough varicella. And within certain time, the memory of the parents are good, and you can inoculate more number of kids with varicella complete protection. There is a PCV booster which is given at the age of 15 months, and hepatitis A second dose already I told, first dose at 12 months and second dose at 18 months. Coming to 4 to 6 years, again IPV dose has to be booster, has to be given in 3+2 schedule. Already I told IPV 1, 2, 3, then one booster, then comes the second booster at 4 to 6 years as a combo, as a tetravalent, that is DPT full or acellular, plus there has to be a IPV component in the name of tetravalent vaccine, and third dose of MMR given. So dear doctors, 10th year is now for Tdap. Why I told T remains constant and the D and pertussis antigen goes down, because after 7 years, if you give full D and full P, the local reactogenicity is good. I mean more. That's the reason to decline that reactogenicity, to decline the acceptance. That means to improve the acceptance of the antigen by the population. You have to give full T, but the smaller dose of D and smaller dose of P has to be given after 7 years. Now, HPV is no more a gender-biased vaccine. It is to be given both boys and girls from 9-year complete onwards till the age of 26 years. Now it is recommended that both the boys and girls to be given, and it has been pilot project has been started by Serum. The study is almost given to DCGA for single dose approval towards the end of this year or maybe beginning of the next year 2025. But as of now, 9 to 14 years, two doses are recommended by IAP 0 and 6. Above 14 years, three doses are recommended 0 to 6 till the age of 45 years. So this is the new recommendation. Always remember, if these vaccines are to be given, all those vaccines are to be kept in a cold chain. And you know, cold chain is the essential of the antigen, the lifeline of the vaccine. The lifeline of the vaccine is cold chain. You have to maintain the cold chain by a office practice that maintain the best cold chain maintenance utility has been done by the ILR, that is ice lined refrigerator. Now Godrej, I mean Blue Star are the companies, they are providing this ILR at cost of 70,000, 80,000, or if it is 225 liter, it is at the cost of 1.2 lakhs. And it is worth spending or investing that much of money if you are vaccinating in your clinic, because if you do not maintain 2 to 8 degrees centigrade, it is as good as not giving the proper antigen, as good as giving the normal saline or distilled water to your patient. So it is an honest request to all of you that always maintain 2 to 8 degrees centigrade. There must be a digital data logger, and that will display the inner vaccine, inner chamber temperature, which is being displayed outside, and that has to be followed. So these two vaccine guidelines we are following in India, coming one after another antigen which are being used in IAP vaccine chart. Tdap vaccine, it is known as decennial vaccine. 7 year onwards it is given. One dose of Tdap to be given at 10 to 12 years. And now IAP is also telling one dose of TD is recommended at 16 years. And Tdap during each pregnancy is very important when it is given as the second dose of T containing vaccine towards the pregnant, towards the delivery, so that what will happen, this gives rise to pertussis antibody in a good amount, which can traverse via placenta to the baby, and it is going to protect from neonatal pertussis till the age of 6 weeks. So Tdap is the second vaccine, and the time the lady becoming pregnant TD and give Tdap at the end of the trimester, preferably 27 to 36. So this Tdap is a must vaccine nowadays in office practice. Many not aware of adult vaccines. Whatever till now I discussed you, it is regarding the children. Now everyone knows in colloquial language or in rural people, if they go for vaccine, we are going for the polio. Polio is synonymous with the vaccine setup or the vaccination sessions. The immunologists are being told them that you have got polio. They have gone to take the polio. They have came back after taking the polio. So this is not only limited. The immunization program has not limited its population till the age of 16, not limited to the pregnancy. It is beyond that. And the best answer we have seen in 2020 onwards in the COVID vaccination, it started from the old age, then it has declined to the age of 12 years, and below 12 years, COVID has not been given to kids in our country. So many not aware of adult vaccines. So let's discuss some light on adult vaccines. National Immunization Awareness Month, adults they do need vaccines too. Why? So why means why adults they need is that if we remember these adolescent boys and girls and adults, they also need vaccines. Why? Because in childhood they might got infection or that they got a vaccination. Usually once they lead to adulthood, what happens? The antibody goes down. So you need some boosters in the adulthood. That is number one. Number two, if they have not got the infection, if they have not got the vaccine, for an example, let's consider about varicella in an adolescent a boy or a girl of 20 years. The varicella may be catastrophic in that age group. If it is immunocompromised, then again it will be more catastrophic. Similarly, hepatitis A in a smaller age group may be asymptomatic, but it can lead to pulmonary hepatic failure in a lower age, I mean higher age group. All those infectious causes or vaccine preventable diseases, if they set in a young age, they are more symptomatic and the morbidity and mortality is high. And that's the reason it is the need of the vaccination is high. So adult vaccination, why it matters, I have already discussed. Let's to protect against disease. Adults are more vulnerable to because of their age or a medical condition. To boost the effectiveness of the vaccines received during the childhood, that is to give the booster. To lower the risk of complications for those with chronic disease. For an example, someone has even diabetes mellitus. They definitely he or she may prone for flu, so they should get annual flu. To benefit from newer vaccines that were not available a few decades ago. For an example, if you see there is a Singris vaccine, or I will tell there is a herpes zoster vaccine. Now it is to be given 50 year onwards. Now 50 year onwards, as the age advances, 10 year plus, the risk of herpes zoster and having a post-herpetic neuralgia is very high. So you can offer this vaccine 50 year onwards. Then 50 year onwards, we can offer PCV13, which can protect from pneumococcal invasive disease. So to protect against some infections during travel and for work-related risks. For an example, if someone is going to Misr or Cairo or in African countries, they should have yellow fever vaccination. They should have meningococcal vaccination. Someone is going for study to UK or Australia in a group, so they should have a special certificate for MMR, typhoid, and even your meningococcal vaccine. So that means they are going overseas for study. So you have to obey the guideline of that country. What other diseases are prevalent in them, and this vaccine where it is available. For an example, yellow fever, you have to get it from recommended hospitals across the country or from Airport Authority of India Limited. So that is the need that this vaccine, if you get that 14 days prior to your travel, definitely you develop the immunity against that disease. And we know that that is the certificate or passport you can enter into that country. Let's discuss about PCV, that is pneumococcal conjugate vaccine. ACVIP, IIP recommend PCV from 6 weeks to 5 years to all children, and beyond that in high risk children. New 10-valent PCV is rolled over in our country in NIP, and now few days back the Biological E-Evans Limited PCV13 in the name of Nibivax, that is both the vaccines are recommended till 2 years. So they have no study right now to be used beyond 2 years in our office practice. And PCV10 from GSK, that is Inflorix, and PCV13 as of now Prevnar 13 from 5 year from Pfizer is also can be used. Pneumococcal disease is the number one vaccine preventable disease causing death under 5, maximum under 2, 1 lakh death, caused by pneumococcal pneumonia, and this has been incorporated into our NIP in the last year, and that is going to prevent 1 lakh death due to pneumococcal disease, which is a big achievement that the 12th antigen introduced in our NIP. There are a couple of antigens, they are in pipeline. I'll tell HPV. Then I will tell mumps component introduction into the MR. Then third one is typhoid. All those vaccines are in pipeline to be introduced into NIP in coming future. Adults only Prevena 13, that means PCV 13. So no other vaccines are recommended at that age group. So more than 5 years with comorbid, I have already told. More than 50 year, any adult or any old has to be getting this vaccine till lifetime. If suppose somebody has taken one conjugate vaccine, 8 weeks later he has to get one polysaccharide vaccine, that is pneumococcal 23 valent polysaccharide vaccine in the name of Pneumovax. So if a 70-year-old comes with or without comorbid, you have to inoculate 1 dose of PCV13 followed by 8 weeks later 1 dose of polysaccharide vaccine. That will be sufficient for pneumococcal prevention. If he has got one PCV13 in the past, then there is no more PCV13 to be given. 1 dose of polysaccharide vaccine will be enough. So that is all about your pneumococcal prevention in adults. Now, recommendation of MMR, already I told 3 doses of MMR, 9 months, 15 months, and 4 to 6 years. No standalone measles dose at 9 months. No MR vaccine is to be given. It is available in office practice. Office practice, as of now, MMR in government sector, it is MR, and they are giving in 2 doses. We are giving in 3 doses. That has to be kept in mind. Let's take a scenario. A government sector has given MR vaccine 2 doses to a kid of 2 years, and that 2 year came to us for taking the mumps component vaccine. Now, at that point of time, I have already told solo mumps is not available, and we have to give MMR 2 doses at least 8 weeks apart. First dose subcutaneous, and another dose has to be given after 8 weeks. So that will be suffices, or you can give 1 dose today and another dose maybe offered at 4 to 6 years. I mean in the preschool entry. Anyway, you have to go for 2 doses. That is all about your MMR. Adults MMR, if you got no history of MMR in the past, at any point of time, catch up immunization. You catch and give 2 doses, 3 months apart or 2 months apart can be given. Any live component vaccine, minimum of 4 weeks gap has to be maintained in order to prevent vaccine antigen interference. So with this knowledge, what about the annual flu shot? Is it recommended for each and every kid? Yes, it is recommended from 6 months onwards till 5 years. And we are giving first time 2 doses 1 month apart, then annual flu till 5 years. After 5 years, ACVIP doesn't say, because by that time the T and B cell immunity is robust and they can fight very capably with the flu virus. Why it is recommended below 5 years? Because this flu make the environment conducive for secondary pneumococcal pneumonia and death due to pneumococcal invasive disease. So ACVIP recommend till 5 years. Now, while influenza can have mild or cold-like symptom, it can also infect school teachers and staff, require emergency room visit, and even cause hospitalization in severe cases. So that's the reason that ACVIP recommends it is to be given to each and every kid up to 5 years. More than 8 year flu shot, if suppose somebody is getting with comorbid, for an example, a child with bronchial asthma, a child with chronic lung disease, a child with, suppose you are thinking that a case which has been having a cystic fibrosis or alpha-1 antitrypsin deficiency. So annual vaccine to be given after 8 years, single dose. After first time 2 doses annually to be given. And whatever the latest trend, that has to be kept in mind. Coming to JE, now sometimes JE are available in our country in 2 names as of now. One is from Biological E, another is from Bharat Biotech. Bharat Biotech is giving 5 microgram and JE is given in 3 microgram and 6 microgram. In NIP, 9 month and 18 month, 2 doses are given, and IAP recommends, or ACVIP, JE in 2 doses, one at 12 month and another 1 month later. So here, if I say coming to typhoid vaccine, now previously when typhoid launched in the year of 2016 and 17 by Bharat Biotech, at that point of time, typhoid was given below 1 year, 1 dose, 3 months later, another dose, or that means 2 years onwards, there is single dose. Now, the typhoid vaccine in any age group, it is given a single dose, and it is the minimum age is 6 months. vaccines with the MMR component. No booster is recommended until 45 years the data says it can be safely given. Now, if typhoid vaccine is given, this is VI polysaccharide antigen and the virulence antigen is there. Once it is given, it is not going to interfere with your Woodall or your IgM typhoid test. So once it is given, usually it is a inoculum-based disease, and definitely subclinical infection will trigger, and there will be anamnestic response, and good amount of antibody will be there to prevent the typhoid disease. So remember, this vaccine is given as of now as a single dose vaccine, particularly those who are going to typhoid endemic countries like Afghanistan or Pakistan. One dose of this vaccine 14 days prior will save them not having typhoid, because Pakistan is known as typhoid where MDR typhoid, this multi-drug resistant and XDR typhoids are very common in belt of the Pakistan and Balochistan. So, dear doctors, if you have any query, you can put your questions in the chat box, and I hope Faraj from IJCP will take out the questions at the end. So please put your questions or queries into the chat box. Now coming to varicella. Also, varicella has been given in 2-dose schedule, 3-month apart, 15-month and 18-month, 2 doses. Any catch-up vaccination at any age, it is to be given 2 doses, 3-month apart. So 2 doses, MMR 2 doses, hepatitis A 2 doses. But if a naive person comes beyond 18 years, then 3 doses of hepatitis B to be given in double dose. That means the 10 microgram 0.5 ml is the single dose in case of less than 18 years. More than 18 years, 0.16, 3 doses of hepatitis B to be given in that age group. Hepatitis A vaccine, if it is a live one, that is from Biovac A, whichever brand name is available, and that is given in single dose. But wherever global data says from GSK, Habrix, they are used in more than 100 countries in 2-dose schedule, 12-month and 18-month. And they are having a long-term protection data to the tune of 30 to 50 years, having 2-dose schedule. Inactivated hepatitis, 2 doses, 6-month apart in catch-up, we have to remember. Now, meningococcal. Now, meningococcal is a disease of immunocompromised child, particularly those who are having nephrotic syndrome under steroids or hypocomplementemia, or those who are having primary immune deficiency with complement deficiency. They are the candidate to get meningococcal, and particularly those who are going to pilgrimage and some part of Africa, given this. And this MCV4, that means meningococcal conjugate vaccine, they are SEWY. So these 4 serotypes are there. If it is given below 2 years, 3 doses, 2 doses to be given, 9 months to 2 years, 3-month apart, and more than 2 years, 1 dose. And if you are dealing with a sickle cell anemia or a immunocompromised host, at least 2 doses, 8 weeks apart to be given. Here, the brand recommended above 2 years in Indian market. One is from GSK, that is Menveo. Another is from Sanofi, that is Menactra. But the Menactra can be used below 2 years, but not the Menveo. However, Menveo, the brand, is applicable outside India, in UK and US, that is given from 2 months onwards. But they don't have license to use this molecule Menveo below 2 years in India. So this is all about whatever the vaccines are there. Now there is a huge demand of this HPV vaccine to be used in not only girls to prevent cervical cancer, but it has been seen that the 16 and 18 are the serotypes which not only prevent cervical cancer, but also prevent vulval and vaginal cancer, and as well as anal, scrotal, and perianal cancer in case of male, penile cancer in case of male, and also laryngopharyngeal cancer in both sexes. So girls 9 to 14 years, 2 doses, 0 and 6, and WHO has already approved for community purpose more than 3 dozen countries in the world that this single dose of HPV vaccine can be used in 9 to 14 years in either sex. It is going to prevent a lot of cancer, HPV related cancer death. And the primary aim and the benefit to goes to the girls in order to prevent cancer death. And we know in our country, near plus 70,000 plus women, they die every year because of the cervical cancer. And if all the girls are being taken before the HPV vaccine, before the HPV infection set in into the cervical mucosa, we can prevent cervical cancer and related death. And that can be achievable even after single dose of this vaccine in the age group of 9 to 14 years. once this vaccine is recommended above, I mean given above 14 years till 26 years, it is to be given 3 years. Only Gardasil 4, which is being approved to be used up to 45 years, that means 3-dose schedule has to be given. So if you see, this is the brand name Sarvavac, manufactured by the Serum India International Limited, that is from the Poonawalla company from Ahmedabad. And this vaccine has becoming a game changer in our India. And Government of India Family Welfare has already done a MOU with a Serum company, and this they are going for 1 dose versus 2 dose in the age group of 9 to 14 years. The government is going to attribute or introduce this vaccine maybe towards the end of this year after election, to be given a single dose vaccine into our NIP, and that will be a very good community perspective, and by that we can achieve near about 70,000 plus death due to cervical cancer can be minimized. But in office practice, this Arvavac 0.5 ml, that is being recommended both boys and girls from 9 years to 26 years. But the Gardasil 9, which is again the 9 valent serotypes which are there, including 16 and 18, 9 and 11 serotypes, they are being recommended to be used in male 9 to 14 years, to be used in female up to 9 to 26 years. So we know that this is the costliest vaccine at the rate of 10,000 per dose, but 9 to 14 2 doses, then 14 year onwards 3 doses. The dosing remains same, but the brand differs, that we have to consider. Adult immunization, finally, how to go about it? Is there any recommendation? Vaccines for adults, we have discussed annual flu, TDA vaccine every 10 years, or TD booster every 10 years. Already I told about the herpes zoster vaccine at age 50, pneumococcal age at 65 plus, along with polysaccharide vaccine. So this national immunization schedule, only TD is recommended for teenagers and pregnant women. No other adolescent vaccine or adult immunization schedule is available by the government of India. IAP recommends 10 to 18 years the adolescent vaccine, TDAP at the age of 10 years, HPV for 9 to 14, and TDAP preferred to TD, followed by repeat TD every 10 years. So 2 doses, 0 and 6 HPV in the age group of 9 to 14. We have discussed that in length. And IAP recommendations of catch-up immunization. That means if we are thinking of giving some antigen in a age group more than 18 years or more than 10 years, you have to think MMR knife 2 doses, 4 to 8 weeks apart. Hepatitis B, already I told, 18 year plus double dose, 1 ml or 20 microgram. Hepatitis A, again 2 doses. After 18 years, it is the double dose. Typhoid single dose. Varicella 2 doses, 4 to 8 weeks apart or 12 weeks apart, 2 doses. So that means the typhoid remains as the single dose. Travelers vaccination, let's discuss few points. Whenever a foreigner plans to visit to Pakistan, which is endemic for wild polio virus, so he or she has to get 2 drops of polio vaccine 14 days prior into the entry into the Pakistan, and one is typhoid vaccine. When and which countries, how to find, there are a lot of guidelines, that is immunization guidelines available in the website, that each country, 220 countries globally, they have their one national immunization guideline. And if suppose somebody entering into that country, probably that vaccination has to be prior to travel, has to be given, and they can enter. Certificate of vaccination to be available for the tourist and students needs when they are planning for the higher study and going abroad. So this travel vaccination, yellow fever for the African countries, typhoid for Afghanistan and Pakistan, hepatitis A, again going for any mass gathering, cholera is for endemic outbreak, hepatitis B is now almost all kids, those who born beyond 2000 and 2002 in India, they have inoculated 3 doses. Rabies is an animal bite vaccine. 95% of the animal bite due to dog bite, it occurs in India, and that caters to near about 20 to 30,000 deaths due to rabies do occur annually in India. So if anybody who is a victim of animal bite, particularly dog, cat, or any wild animal, the wound toileting is recommended. Wash the wound under soap water at least for 10 to 15 minutes. Then you can apply betadine or povidone iodine to the wound. Then you go for hepatitis cat 2, then 0, 3, 7, 14 to 28, 4 doses to be given as per WHO and ACVIP. But till now, NCDC India, that tells about the 5 doses, 0, 3, 7, 14, 28. 5 doses are recommended. In cat 3, whenever there is a oozing of blood, then you have to go intralesional injection of either human rabies immunoglobulin or either monoclonal antibody, monocomponent or duo component has to be given. So rabies vaccine is an animal bite cases, you must be well versed. Catch-up immunization for adolescents, that is polio. We are not giving polio, excepting pulse polio beyond 5 years age group. 5 year age group plus, we are giving single dose of IPV, that is good enough. 2 doses, MMR 2 doses, varicella 2 doses, and HPV 2 doses 6 months apart. Tdap adults, adolescent we have discussed, 1 dose at 10 to 12. Teens 11 to 18 who did not get at that time, again single dose to be provided, and thereafter every 10 years. In between, remember, if the child has got 16, 14 weeks till 1.5 years, no vaccine T containing. If the child got 1.5 year booster till 5 years, no T containing. If the child got 5 years till 10 years, no T containing vaccine. Then if the 10-year vaccine given third booster, then comes to T containing vaccine. That has to be given. MCV4 recommendation is 1 dose to be given. Singles already I told, older age group, once the immunity goes down. So if than 50 years, then he or she can take recombinant intramuscular, 1 dose 0 and another dose to be given later, because it is very morbid condition and it gives rise to post-herpetic neuralgia, very troublesome. This is another vaccine which is very costly, at par with Gardasil 9, that is also 10,000. These are the two costliest vaccines per dose. Administer all needed vaccines, ensure vaccines are prepared, administered incorrectly. All live vaccines, viral vaccines are given subcutaneous. All adjuvant containing vaccines are given intramuscular. Never ever any vaccine to be given intragluteal. If it is given intragluteal, the depot will be there and the release to the immune system will be erratic, and that dose has to be taken as invalid. Tdap, meningococcal conjugate HPV vaccines can be administered during the same healthcare visit, and influenza vaccine during flu season. Administer any vaccine that may have been missed earlier in the childhood, that is the need of the vaccine in adulthood. Girls must before pregnancy, one is MMR and HPV. Why? Because MMR vaccine can give rise to or can prevent congenital rubella syndrome, and HPV definitely it will protect the mother not to have cervical cancer as well as other HPV related disease. Already I told vulval cancer, then you say vaginal cancer, then anal cancer, and laryngopharyngeal cancer. All those cancer, HPV related cancers, will be prevented by giving this HPV. Even if it is quadrivalent, the 16 and 18, they are the major strength of oncogenic, and even though other 5 oncogenic variant for cervical cancer which is included into that, but HPV4 is good enough for our country as economical perspective or economical way is considered. During pregnancy, already I told, the start with TD, end with TDAP between 27 to 36 weeks, and because annual flu doesn't prevent, not only prevent, but also going to prevent the flu by the anti-flu antibodies traverse via placenta to the baby, and prevent flu up till the 6 month, till we are giving the flu vaccine at the age of 6 months. This is very, very important. And pan India, pan globally, now it is being recommended TD, TDAP, and the flu is the need of the vaccine in pregnancy. So 1 or 2 lines on animal bite, dog bite. Leaks on unbroken skin, wound dressing or wound toileting is important. Category 2, when oozing of blood is not there. Category 3, when oozing of blood is there. Recommended treatment, cat 1 nothing, cat 2 local treatment of the wounds and ARV, and category 3 monoclonal antibody or the rig has to be given. Wash the area of animal bite thoroughly under soap water at least for 10 to 15 minutes. That can minimize the load of the virus locally to the tune of half. If severe bleeding, infiltrate rig intralesionally, no role of immunoglobulin intramuscularly. So try to give as much of as immunoglobulin into and around the wound. That is the answer. WHO 2018, that has been adopted by the ACBIP last year 23, and they recommend 4 dose instead of 5 doses. So 4 dose schedule 037 and 1 dose 14 to 28. It is to be given in delta. Almost all vaccine intramuscularly to be given in intramuscular delta above 2 years, and below 2 years it is the anterolateral aspect of the mid thigh. Never ever any vaccine to be given in gluteal zone, and the reason I have already told. WHO recommends use of monoclonal antibody, that is cocktail containing at least two antibodies against rabies as an alternative for rabies immunoglobulin in post-exposure prophylaxis, because the rabies is a very dreaded disease, 100% fatal if suppose an animal bite. Only way of preventing rabies is by rabies immunization. So coming to the summary point, adults continue to be advocates for vaccine preventable diseases. Recommend vaccine to your patients and their parents. Ensure adolescents and as well as adults receive all needed vaccines as per their age. And this, whatever we have knowledge that immunization for the kids, I will tell you, immunizations not only for the kids but also all ages throughout life, and they are having age specific a responsibility to have that disease, or they are prone for vulnerable for that vaccine preventable disease. So already we discussed like typhoid, HPV, then comes your MMR, chickenpox, hepatitis A, annual flu. All those are recommended vaccines in adults and old population as well. So that means the topic was updates on immunization for all ages. So that means this vaccine is the need of the hour. So I request all the doctors who are logged in, please be a brand ambassador for the vaccines. And this vaccine definitely is going to change. The best gift to a kid or a woman is preventing from a disease by giving vaccine. No one can give guarantee that this particular individual is not going to die of meningococcal disease or pneumococcal disease or typhoid disease. That nobody can have guarantee. So the best way for preventing not to have death because of the vaccine preventable disease, that is to inoculate the right vaccine in the right way for the right route. Then only we can give guarantee that almost all the vaccines are safe. AEFI following them is very minuscule, and major AEFI is not going to happen with any amount of, any antigen. So with this, I will tell, let's get vaccinated, protect yourself and your community and your people surrounding you. They should have be protected by the vaccination. So that means thank you very much, dear all doctors, those who are patiently listening for last 1 hour and 45 to 50 minutes, this immunization for all ages. And to sum up, in our India, if you're vaccinating, you have to follow the latest guideline. Either it could be Government of India or either it could be ACVIP guideline. Doesn't matter. Foxy guideline for pregnancy is same what we discussed. Now, adult population or more than 50 years. Already I told annual flu, then pneumococcal 13 followed by pneumococcal polysaccharide vaccine. Then at that point of time, the one which is being recommended now is your herpes zoster vaccine, and there are a couple of vaccines there in pipeline now. There is HSV, that means I tell RSV vaccine, that means respiratory syncytial virus vaccine is also now recommended for that. And now the malaria vaccine, which has been as a pilot project, that malaria vaccine already been the Takeda vaccine, which has been used in the African population, and serum also last few days some vaccine regarding malaria that has been finished the human trial, and they are going to start in the African population. So a time will come, it is not only 12 antigen, many more antigens will be added into the national immunization schedule, and many more antigens will be added into the office practice. One of them I told, that is RSV vaccine, and so on and so forth. With that, I respect all of you. I thank each one of you for logging into this vaccination webinar. I thank Faraj and the total team of IJCP for wonderfully they are preparing this type of platform for dissemination and deliberation of knowledge to the community. The main aim and objective to prevent death in our community, to prevent death in our kids. With that note, I thank again once you all. If there are any questions, I will request Faraj to ask me. I will try to solve those questions if at all it is there. Over to Faraj. Thank you very much.
Yes, sir. Sir, thank you so much. All credit goes to you, sir. Like doctors like you come on this platform to spare awareness on the healthcare sector, sir. And I definitely think this session knowledge is going to help all the participant doctors who have joined this session. Sir, we have received some question. With all your permission, shall we take this question?
Yes, yes, please.
First question is from Dr. Suranjit, and the question is, how effective are the current vaccine for preventing serious illness in the elderly patient with comorbidities?
You remember, Dr. Suranjit, always remember this is the question related to vaccination in special situation. What is the special situation here? A child or an adult with comorbid. You think what are the comorbid? Comorbid can be classified number one, those who are on prolonged steroid, those who are on immunosuppressants, those who are on monoclonal antibodies, those who are on renal transplant or any solid organ transplant, those who have got bone marrow transplant in pregnancy, in foreign, those who are going. So these are the conditions. Out of them, you have asked one those who are having comorbid. Let's consider a chronic liver disease is a comorbid. Now, chronic liver disease, if they by chance got hepatitis B or hepatitis A infection, the probability of damage into the liver is more than 100-fold. What the damage is going to happen in a viral hepatitis due to A or B in a normal child, this is many-fold. It is more than 100-fold into them. So they need to be protected from hepatitis B and A, the two vaccines which are available in a chronic liver disease. For an example, in a case of chronic lung disease, they should be protected from pneumococcal disease. So similarly, there are many conditions, they are comorbid. If you are thinking that these comorbid conditions, the specific vaccine, I'll tell another comorbid, sickle cell anemia. Now, sickle cell anemia more prone for capsulated sepsis. Now, capsulated pneumococcal sepsis is more 30, 40 times higher than the normal population. So they should get capsulated vaccine. That is number one is your pneumococcal vaccine. Then comes your meningococcal vaccine. Then comes salmonella. And finally, we can tell HIB, Haemophilus influenzae. Now, Haemophilus influenzae B is not available as solo. So that's why the before three vaccines has to be given. So any child who is having comorbid or any person who is having comorbid, the chance of getting infection from the vaccine preventable diseases increases. And that's why we have to go with the chart. What are the vaccines given in their childhood? If some vaccines not being given at that particular age, they can be picked up and they can be given in order to protect them from vaccine related diseases and morbidity and death. For an example, again I'll tell, a nephrotic child is a comorbid. That means here they are having immune dysregulation and they are under immunosuppressants like steroids. If they are having steroid and off steroids, after 1 month of stoppage of steroids, we can go for pneumococcal vaccine, which can save, or varicella vaccine. This nephrotic child having varicella is very catastrophic. We may lose the child. So some vaccinations having more important in comorbid, and we should take care of that by vaccine knowledge. This comorbid, the specific antigens has to be inoculated for the better survival. At least they should not die of vaccine preventable disease. Over to
Thank you so
Faraj.
much, sir, for sharing your insight on this question, sir. You have explained really well. I hope that participant have received his answer. Sir, as I can see, sir, there is no more question from the participant. I hope you are able to done justice to this topic, sir. Like all the participants have got the points, like you have beautifully presented the things. One feedback is from Dr. Akansh Shashi has written, much needed topic and well presented.
Thank you, Akankya. Thank you.
Yes,
Always,
sir. And
always, what I feel, if deliberation is there by a speaker, whoever may be a speaker, but at that point of time, he's a speaker. He speaks from his past experience, from his knowledge, and everything. One appreciation is good enough. It is a good, what can I say, a reward. It is a satisfying reward to the speaker. And I appreciate Akankya for your appreciation. I hope you have done. You have made my day because I love if suppose somebody, because we are doing a lot of labor, lot of difficulty, lot of time. We are innovating a lot of time for preparing this type of thing and delivering to all of you. So if your appreciation is there, definitely we are happy, and no amount of money or no amount of anything can match to this happiness. And this happiness, you have made my day. Thanks, Akankya, for appreciation, and all the
okay, sir.
doctors.
And thank you so much, sir, for once again for taking out your precious time, sir. We would like to see you in future also with new topics, sir. Till then, take care of yourself. Have a great day, sir. We are closing for today, sir. Thank you so much.
Thank you. Thanks a lot. Thanks, Faraj,
Welcome.
and your total IJCP team. Thanks a lot. Jai
Welcome, sir.
Jagannath.